Hello, I have just asked the patient to empty her bladder and change into a gown for today's exam. I took her height, weight, and vital signs. I also conducted a distance vision using the Snellen chart and a near vision using the Rosenbaum card. This tested for cranial nerve number 2. I also am going to watch her gait as she walks into the room and her general appearance. I have washed my hands and I am now ready to begin my exam. Hello, I'm Sarah. I'm going to be doing a head-to-toe exam on you today. I'll be talking to the camera as I go along. First, I'm going to inspect her face. Her head is normal cephalic. It is warm to the touch. I don't see any moles, nevi, or lesions. Her skin turgor is elastic. I'm going to test her cranial nerve number 7. Can you clench your teeth? Can you close your eyes tight? Wrinkle your forehead? Smile? Stick out your tongue? And puff out your cheeks. Okay. The patient's cranial nerve number 7 is intact. Now I'm going to go on and palpate her hair and skin. Any pain or tenderness? No. She has no pain or tenderness. There are no masses noted. Her hair is intact. There's no alopecia, and there's no coarseness noted. I'm going to go on and palpate her facial bones. Any pain or tenderness? No. Okay. Now I'm going to palpate her frontal and maxillary sinuses. Any pain or tenderness? No. Okay. Now I'm going to look at her temporomandibular joint. Can you open your jaw and close? Any pain or tenderness with that? No. Okay. Now I don't note any popping or clicking either. This is a normal TMJ exam. Now I'm going to test her light sensation. I'm going to do this using a Q-tip. I'm going to use the soft end and the hard end. I just want you to tell me if this is soft or hard when I touch your face. Soft. Soft. Sharp. Sharp. Soft. Soft. Okay. This means that her cranial nerve number 5, the trigeminal nerve, is intact. All right, so now I'm going to inspect her eyes. And her eyebrows are normal. I don't see any redness, no moles, no lesions. No crusting is noted. She has no xanthelasma. Let me look at your conjunctiva. It is pink and moist. Her sclera is white and there is no jaundice noted. Now I'm going to palpate over her lacrimal apparatus. Any pain or tenderness? No. There's no pain or tenderness, no swelling, no drainage noted. I am going to test her pupillary response next. I'm going to do this using my light. Okay. Can you just look straight ahead? Her pupils are round and reactive to light. They're 3 millimeters. They were consensual. I'm going to now do the cover and uncover test. Can you cover one of your eyes? And uncover. And cover the other eye. And uncover. Okay. There is no strabismus or nystagmus noted on this test. Now I'm going to go on and test her 6 cardinal fields of gaze. This tests cranial nerve 3, 4, and 6. So I'm going to have her look straight ahead at my pen light and follow it as I move through all 6 planes. Good. Her cranial nerve 3, 4, and 6 are intact. Now I'm going to move on to her ears. I'm going to inspect her ears, looking at her auricles. Her ears are symmetric. Her auricles don't show any crusting. They match the inner canthus of her eye. which means that her ears are not low set. Sorry, the outer campus of her eye. I'm going to now palpate her auricles for tenderness. Any pain or tenderness? No. She notes no pain or tenderness. So now I'm going to look inside of her ears with the otoscope. Okay. So I'm going to pull the auricle up and back as I look inside of her ear. Okay. And I'm going to check the other side. Both of her tympanic membranes are pearly gray. I do not see any bulging or erythema to either ear. Okay. Next, I'm going to do cranial nerve number 8. By doing this, I'm going to do the whisper test. So I'm going to stand behind her. I'm going to whisper 3 letters or numbers and have her repeat them back to me. Can you cover one ear? A, B, C. Okay. And cover the other ear. 1, 4, 7. Good. Okay. She got over 50% right, which means she passed this test, and her cranial nerve number 8 is intact. Next, I'm going to use a tuning fork to evaluate her hearing and see if it's equal bilaterally. First, doing the Weber test. I'm going to strike the fork and I'm going to place it on top of your head and just let me know if you hear it equally bilaterally. Do you hear equal?
Yes.
Okay. Next, I'm going to move on to the Renee test. I'm going to do this by striking the fork again, placing it on her mastoid bone and then in front of her ear. Just tell me when you stop hearing it. Okay. The air conduction should be longer than her bone conduction. Stop. Stop. Okay. So this was 2 times longer than her bone conduction, and that is a normal finding. Now I'm going to move on to her nose. I'm going to first inspect it. Okay. It has no deviation, is no lesions, no moles, skin is intact. I'm going to look inside of her nose with my otoscope. Okay. I'm going to look at her membranes inside of her nose. Good. Her membranes are pink and moist. There is no cloudiness or blueness, which would be a sign of allergies. I'm going to check the patency of your nostrils. So can you cover one nostril? Breathe in for me. Can you breathe normally?
Yes.
And cover the other? Breathe in. Are you able to breathe normal?
Yes.
Okay. This is checking and shows that there are no signs of turbinate dysfunction. Now I'm going to move on to her mouth. Again, I'm going to inspect it first. I don't see any fissures, cracks on her lips. They are red and moist. I'm going to look inside of her mouth with my pen light. The anterior and posterior pillars are intact. Her posterior thorax is intact. I can see her uvula, her tonsils, soft and hard palate. Go ahead and touch your tongue to the roof of your mouth. I don't see any lesions, no sign of oral cancer, which is what you would see underneath her tongue. Let me check your teeth. I don't see any fillings, no missing teeth, no foul or breath. Her tongue is smooth. There's no roughness to it or no coating on her tongue. Now I'm going to test cranial nerve number 9. I'm going to look at her uvula and I'm going to have her say ah. Say ah.
Ah.
Good. Her uvula rises, and this is a sign that her cranial nerve number 9 is intact. Next, I'm going to test cranial nerve number 10. I'm going to do this by testing her gag reflex. Can you open your mouth? Okay, good. Her gag reflex is intact. Now I'm going to move on to inspect her neck. It is symmetric, it is smooth. I don't see any jugular vein distension. I'm going to check your range of motion. Can you look down, look up, look to your left, look at me to your left, look to your right? Good. Now I'm going to test your muscle strength and your resistance against me. Go ahead and push down against my hand. Good. Push back. Good. Push to your left. Turn to your left, I'm sorry. And turn to your right. Good. Okay. She shows good muscle strength and range of motion. Now I'm going to go ahead and test cranial nerve number 11 by asking her to, can you shrug your shoulders? Good. Cranial nerve number 11 is intact. Now I'm going to palpate her carotid pulses one at a time. Okay. Pulses are strong and equal bilaterally. I'm going to take a look at her trachea. I'm going to palpate this. Her trachea is midline. Can you swallow for me? Good. And her thyroid gland, her thyroid moves up as she swallows, which is a normal finding. Next, I'm going to palpate her lymph nodes. I'm going to start with the occipital, postauricular, preauricular, tonsillar, submandibular, submental, posterior cervical chain, superficial cervical chain, deep cervical chain, and her supraclavicular. Any pain or tenderness? No. No. She has no pain or tenderness, and I don't note any lymphadenopathy when I palpate her nodes. Next, I'm going to auscultate her carotid arteries and her thyroid, listening for any bruits. I need you to take a deep breath for me, and I'm going to do this using the bell of my scope. Good. You can take another deep breath and hold it for me. And then auscultate over there. Good. No bruits were heard. If we had heard any over the carotid arteries, it would have shown some stenosis. And if we would have heard it over the thyroid, that can show hyperthyroidism. Okay, so next I'm going to take a look at your upper extremities. Can you hold both your arms out for me? Good. Okay, both arms are symmetrical. I don't see any concerning moles, lesions. Her muscle strength is equal. No signs of atrophy. Good. Okay. And let me take a look at your nails. Her capillary refill is less than 3 seconds. I don't see any clubbing. Good. Okay. Now I'm going to check her radial pulses. Okay. Her pulses are strong and equal bilaterally. I'm also going to check her brachial pulses. Which are also strong and equal bilaterally. Now I'm going to move on to her back and her posterior chest. I'm going to kind of lift this up just a little bit. Okay. I don't see any moles, any lesions. Her back is pink, warm, intact. Okay. Can I have you go ahead and stand up? I'm going to check your spine. Bend over for me. Good. All of her vertebrae are intact. I don't note any scoliosis. Go ahead and stand straight. Can you twist side to side and bend side to side? Good. Her muscle strength is good. Her range of motion is good. Go ahead and sit down. Okay. Next, I'm going to palpate and percuss over the costovertebral angles, over the kidneys. Any pain or tenderness?
No.
Okay. Now I'm going to look at her lungs. Her respirations are equal. Her chest expansion is symmetrical. I don't see her using any respiratory or accessory muscles when she breathes. I'm going to first palpate posteriorly for tactile fremitus. I'm going to have you say 99 as I place my hands on the back of your chest.
99.
Again?
99.
Again.
99.
Good. No tactile fremitus is noted. Next, I'm going to percuss over the posterior and lateral chest walls. This should sound of a resonant sound. Can you lift your arms out to the side? Good. And her lung sounds upon percussion were resonant. Okay. Next, I'm going to percuss for her diaphragmatic excursion. And so I'm going to have you go ahead and exhale out and hold your breath. Okay. And I'm going to percuss down on the right side till I hear dullness, resonance change to dullness, which is right here. You can breathe for a moment. Okay. And now I'm going to have you take a deep breath in and hold it. I'm going to do the same and percuss up until the resonance changes to dullness. And there it is. Good. That's about a 3 centimeter gap. Normal on diaphragmatic excursion is about 3 to 5 centimeters. Next, I am going to auscultate over her posterior and lateral lung fields as well. And I'm going to ask you to take a deep breath in. Good. And again. Again. Another deep breath. Again. Go ahead and reach your arms out to the side again. Take a deep breath. Good. Deep breath. And then again. Good. All right. Her lung sounds were clear in all planes. Now I'm going to move on to her anterior chest. Looking at her skin. Here it is. I don't see any masses, moles. It is symmetric throughout. I'm going to palpate her pericardium, looking for thrills, heaves, or pulsation. And I don't note any. Now I'm also going to palpate down, feeling for her apical pulse. Good. That is strong and it is a strong pulse. Next, I am going to percuss. I'm going to percuss down her anterior chest wall to the 6th rib. Again, listening for resonance. Good. And resonance is noted in her anterior chest walls as well. Now I'm going to auscultate her lungs. Go ahead and take a deep breath. Good. Her chest expansion is symmetrical. Her lung sounds are clear in all planes. I'm also going to listen to her 5 heart sounds. First, listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. I can hear S1 and S2. I don't hear any rubs, any murmurs or thrills, and she has a regular rate and rhythm. Now I'm going to go on to inspect her abdomen. So I'm going to ask you to go ahead and lay back for me. And I'm going to pull your shirt up a little bit here. Okay, so her umbilicus is midline. I don't see any masses, any lesions. She has a regular contour to her abdomen. When she breathes with inspiration, her abdomen rises in a symmetrical fashion. I can see her aorta pulsing, but she is a thin individual. This doesn't represent an aortic aneurysm. Next, I am going to auscultate. I'm going to listen in all 4 quadrants, listening for bowel sounds. Good. I can hear all her bowel sounds. You should wait 5 minutes before stating that the patient does not have any bowel sounds heard in any of the 4 quadrants. I also don't see any distension of her abdomen, no bulging. So next I'm going to go on to palpate. At first I'm going to lightly palpate. Any pain or tenderness? No. I don't note any crepitus. Now I'm going to palpate deeper, first feeling on the right costal margin, looking for the liver, which I can feel right there. I'm also going to palpate over here on the left. I should not be able to palpate the spleen, which I don't. That would indicate that it's enlarged. I'm going to palpate the right and left kidneys. Okay. I don't see any guarding. Did you have any pain or tenderness? I don't know any masses. I'm going to feel the midline for any pulsations. Next, I'm going to auscultate over the aorta, renal, iliac, and femoral arteries, which I should have done earlier when I was auscultating the 4 quadrants. I'm listening for any bruits. Good. And I don't know any bruits upon auscultation. Next, I'm going to percuss down the right side, listening for dullness where her liver would be. You can hear it right here. Good. Her liver span is about 10 centimeters, which is normal. I'm also going to go down the axillary midline to the last intercostal space. I'm going to put my fingers over it and percuss here. Good. There should not be any dullness present, which it is resonant. If dullness was present, that would mean that the spleen is enlarged. Next, I'm going to have you go ahead and sit on up. I'm going to inspect her feet and legs. Go ahead and I don't note any edema, no abnormal bruising, no abnormal moles. There is no hair, but that is because she shaves her legs. I am also noting there's no atrophy and looks like she has good muscle strength in her legs. I'm going to palpate for her dorsalis pedis, posterior tibialis, posterior tibial and popliteal pulses. Can you scoot back on the table a little bit for me? Good. Pulses are strong, regular, and equal bilaterally. Last, I'm going to test her reflexes. First, I'm going to test her brachial reflex. So go ahead and just hang your arm loose. Okay. Same thing on this side. Go ahead and hang it loose. Good. And I'm going to test her knee reflex. Go ahead and let your knees dangle off the table for me. Good. Good. And last, I'm going to test her Achilles reflex. Can I have you go ahead and stand up and put your knees on the table so I can get good. Good. And let me do the other side. Good. All her reflexes are intact. And I think that concludes my head to toe examination. Thank you.